Hello everyone, welcome back to Axon Health. For our YouTube video this week, we're going to cover 5 common questions that most chiropractors are probably asked. There's much more questions that are asked to chiropractors, but these are probably 5 very common questions that I've seen anecdotally that other chiropractors I'm friends with or people who have been in practice for 20, 30, even 40 years. So let's jump right into it. Question number 1, is spinal manipulation the only thing you do? Now, most of these are going to be context dependent. In school, which is 3.5 years, we get an array of different classes going from rehab stuff to soft tissue, stabilization, spinal manipulation. There are some chiropractors out there that just perform spinal manipulation. We call them more straight chiropractors, old school chiropractic. This isn't inherently good or bad. It's really going to come down to patient preference. A lot of these chiropractors only manipulate and they get a lot of people better. It's not what I do. It's not how my philosophy on treatment is. But to say that it doesn't work, I wouldn't agree with that. It's just what those people like to do. If you're seeking a chiropractor, you're going to have to find a chiropractor that you kind of mesh with. It's going to come down to, do you need maybe more stabilization, more mobility, more flexibility, more soft tissue, more myofascial release, a combination of everything? It's really going to come down to how you feel with that chiropractor. If you go to 10 different chiropractors, you hear 10 different things. Some are more evidence-based than others, some are more anecdotally based than others. That's just the way it goes. Nothing bad to say about anyone. Number 2, huge. Is spinal manipulation dangerous in the cervical spine, aka your neck? This is very context dependent. I'm going to talk about a research study. It was a longitudinal study that they looked at Medicare patients. I think it was over either 1.6 or 2 million people that have had a VAD, or vertebral artery dissection, or led to full-on stroke, cerebral hemorrhaging, and so forth. And what they found was people that got spinal manipulation, there was zero correlation at all. This myth is still alive and well. I have a lot of patients who actually tell me, I don't want you to adjust my neck. Now, the wrong thing to do is try and convince that patient that they need spinal manipulation, because that's not entirely true. Now, if their facet joints are really locked up and maybe they have torticollis, which is a spasm of the SCM muscle, your sternocleidomastoid, and other conditions where spinal manipulation might be very helpful in the acute phase of care, but they don't need to get their neck manipulated. A lot of people are afraid of the crack. And what the crack is, the cavitation, like when you crack your knuckles, the research kind of goes back and forth, and I kind of agree with gas leaving. It's just gas leaving the joint space. Some research suggests gas going back into the joint space. I'm more aligned with gas leaving the joint space. That's all that is. Hearing the crack is also not indicative of the neurophysiological function of what happens in an adjustment when they do objective scans. So again, is neck spinal manipulation dangerous? It's context dependent, but 99.9% of the time, no. Now, let's say someone comes in, they have extremely high blood pressure, they have other neurological signs, or orthopedic testing is showing you things that you don't really feel right about. Then no, spinal manipulation is not safe for the neck for those very few individuals. But it's not the common. There was a lot of people that were claiming that spinal manipulation in the cervical spine causes stroke. And correlation does not mean causation. Anyone who reads research and understands or interpret research understands that in the chiropractic profession. Again, if you don't want to get your cervical spine manipulated, that's completely fine. It's your life, your choice. There's other ways to work around that. Number 3, I heard I have to see you 2 times a week for the rest of my life. Now, not so much as common now as it is, say, maybe the older chiropractors who have been in practice for 20 to 30 years. A lot of it was, I got to see you 3 times a week for 3 weeks, 2 times a week for 2 weeks, and so forth, arbitrary, or sometimes I have to see you 2 times a week for an indefinite amount of time in these packages. Now, while some people might like that, whether it's placebo or not, that's not how I practice. The current guidelines for an acute phase of care, which are kind of similar between physical therapy and chiropractic, this is also intertwined with if you're billing for insurance, and if insurance is going to cover you and so forth, or if you're a cash practice, or you do super bills and so forth, which is where you pay in cash and I give you a receipt, and then you bill the insurance company yourself for reimbursement. But usually 10 to 12 visits for an acute phase is what's covered or deemed necessary, and that's how you see fit. Now, not everyone's going to fit these guidelines. Some people might not need 10 to 12 visits. So to say that every single person needs 10 to 12 visits for an acute care plan, it's not evidence-based. I'm not saying it's the worst thing ever, because people do enjoy that. It's just not what I do particularly. You never want to put people down People like doing different things, and that's up to them. Some people, I tell people, you might have a patient that's like, I want to see you once a week forever. You say, hey, look, I don't think it's particularly necessary. They're like, I don't care. It makes me feel better. I like the way it feels. I like the benefit because maybe I'm a heavy power lifter. My joints just don't move a whole lot. For who knows why. There could be multiple reasons why their mobility or their stability is shit. So it all comes down to patient preference. But if a chiropractor tells you they have to see you 2 times a week or 3 times a week, I don't know. It's just not how I roll, and the evidence really isn't indicative of those guidelines. Number 4, do I need x-rays to see you? Man, is this question content dependent? Yeah. So, how do I want to say this? X-ray looks at bone pathology. That's really what we're looking at here. It's not the gold standard for soft tissue because that's MRI. So you're not really going to see a disc herniation. Now, if you see a decreased disc space on a radiograph in the lumbar spine, that might be indicative of if they have other radicular symptoms, so pain going down their legs, that, okay, it might be time for an MRI. But here's the thing. This is where everyone gets treatment wrong. And I've had this conversation. People think, well, you should shoot to look just in case. In my personal opinion, not saying I'm right, if you do correct ranges of motion, orthopedic examinations, MRS, muscle, reflex, and sensory, and you understand the outcome measures for all these different tools, shooting an image is to confirm something. I am a strong believer of that. You don't blindly look because that bleeds the medical system to death. You'll have someone, maybe a primary care, this is not, again, medical doctor, but it's called non-specific low back pain for a reason. I have low back pain. Okay, let's do a full lumbar series on you. That's not clinically warranted. Now, what happens is that bleeds the insurance system dry and it raises all of our premiums. It's a multifactorial approach. I don't think arbitrary number, 98% of people need imaging to see a chiropractor. Now, there are people that may need it. Maybe you're seeing, you're suspecting some sort of a clay shoveler fracture where their spinous process is broken off, maybe a football injury or other type of bone problems, a compression fracture, then yes, you could shoot an x-ray. But to just get general, say, wellness or maintenance, if you want to call it that, for chiropractic, with no other clinical guidelines coming from your actual examination, then absolutely not, in my opinion. I'm not saying I'm right. That's how I practice. There are people who are, say, Gonstead practitioners who are straight chiropractors that shoot x-rays on every single person, and they base mobility off their treatment off of the x-rays. That's completely fine. People love that, and they get great results. It's just not how I roll, and that's completely fine as well. Number 5, big one. Are you anti-medication? Before I go any further, I must say as a chiropractor, I am not allowed to give any recommendations on medication, and that's just the way it is. I took a couple toxicology classes in school because we have patients that are being co-managed by primary cares or other physicians, and so it's nice to be like, I don't know what the heck this is, in front of your patient, and be like, oh yeah, for sure. And in your mind, you're like, excuse me, I have no idea what this is. So we have a little bit of toxicology, and it was on our national boards, but that's besides the point. I'm not anti-medication. Medication can be great in many places. Again, as always, it's context dependent, but I am against people having, say, an ankle sprain or a ligament injury and getting opiates. It's not as bad as it was, but it's still decently common in the personal injury world where I came from, the PI world. And I can go into that for 5 hours talking about how lawyers will try and dictate your care when they don't have medical degrees and referral systems, and that's a whole nother talk. And it's a sad system. Not everyone, but for some. But yes, I don't think so. Here, I'll give you another study. The evidence-based chiropractor, who is probably one of my favorite podcasts to listen to, Dr. Jeff Lang made, he talked about a study that they looked at, I think it was 10,000 people, don't quote me on that, people who saw from 20 years primary care medical doctors for non-specific low back pain. And I think it was 30% got painkillers or opioids. The clinical guidelines support maybe 1% of people, sinister, true malignant pathology, cancerous, bone pathology, severe radicular symptoms, burning pain, can't walk, crazy spinal stenosis. Maybe. That's a maybe, not even a definite, because remember, research is suggestive. It's not fact. We have scientific studies, and then we have scientific laws, like gravity. I always say that. If you drop something in this universe, on this planet, it drops every single time. That has been proven to be wrong. That is a scientific law. A lot of people will look at research and interpret it as a scientific law. And this is a misunderstanding. When you read research a lot, you'll see at the bottom of every single study, we need more research. It's what they say. It's almost like they have to put that. But yeah, that's a big, big problem. And people are still getting, and listen, it's not anyone's fault. If you've been in practice for 30 years and that's what you learn from med school and you don't keep up with research, it's not the most optimal thing, but to say you don't help people ever is not true. It's just in those specific cases, they probably don't need any sort of painkillers like that. Also, looking at people's addictive personalities, like myself, highly addictive personality. I can tell you for myself, like I had kidney stone surgeries in February. Yes, I wanted some morphine, for sure. Some people have maybe just some odd low back pain and they'll get prescribed a hydrocodone. No chance. I don't agree with that at all. Again, I cannot give any recommendations, but I am allowed to talk about it in my opinion. And that's just how I feel about that. The last question. I left this here for a good reason. Are you a real doctor? Get asked that all the time. There's no point in talking about this. Usually what happens is in the advanced degree fields, what I see a lot is a lot of people trying to validate their own self-worth through their PhD or their doctorate, whether it's a physical therapy doctorate, chiropractor, medical doctor. I'm a real doctor, you're not a real doctor. And that comes down to not accepting other people. Remember what I talk about in a lot of other videos. If you have unconditional self, other, and life acceptance, you don't have to agree with them, but you're not going to get into an argument saying, oh, you're not a real doctor. That's completely fine. Most people, that's not a true statement, what I was about to say, but there's shitty people in all professions. People who don't keep up with research, people who don't take care of themselves, either medical doctors, chiros, PTs, severely obese, and so forth. It's way too black and white to just be like, that person's not a real doctor and so forth. Now, as a human, you're allowed to have what you want. So I've been asked this. You don't get angry when someone says you're not a real doctor? Absolutely not. Me trying to convince you that I'm a real doctor is irrational because I think that I must change your mind. I don't have the right to change anyone's mind. It's a big problem in today's society. You're trying to forcefully change the external environment. I don't want to go off on my soapbox and cognitive behavioral therapy right now, but that's just the way it is. So whoever's watching this video, if you think chiropractors are quacks, that's awesome. I'll refer you to someone else I know. That's completely fine. If you're not safe seeing me, that's good for you. I don't mind that. It's okay. There's plenty of people I help, plenty of people I co-manage with, talking about exercise physiology, research, nutrition. I got buddies who are RDs, researchers in exercise physiology, medical doctors. It's okay. It's fine. Everyone likes different things, and they, as humans, are allowed to do that. Thank you so much for listening. This isn't the full gamut of all the questions that were asked. These are just very, very common questions. Do you do nutritional stuff? I'm keep up a lot with the nutrition, big time. Been counting my macros for 10 years. I read all the current literature, Lane Norton's Fat Loss Forever book, RP Diet book too, all that stuff, keeping up with it. And in my scope, I'm allowed to give nutritional consultation in this state. But say I have someone that has a severe pathological problem, that's not what I do, and that's okay. So I send that to an RD or maybe a functional medicine doctor who knows more about the actual pathological side with nutritional. When it comes to like clinical application for fat loss, absolutely, that's my jam. Really good with that. So thank you guys for listening. Chiropractors are different. Some chiropractors do some things, some do others. It's completely okay, even if you don't agree with it. Have a great day.